Okay, we'll continue on with blood pressure. I think I'm being redundant on a couple slides here, but blood pressure is the measurement of the force of the blood against the walls of the arteries. Systolic is the top number when the heart is contracted, and diastolic is the bottom number when the heart is relaxed. Hypertension is high blood pressure. Hypotension is low blood pressure. And orthostatic hypotension is when there is a drop in blood pressure when a person changes position from lying, sitting, or standing. That may cause dizziness or fainting. Equipment needed to take a blood pressure. You need a stethoscope, and you need a sphygmomanometer, which is the blood pressure cuff. It needs to be the correct size. The wrong size can lead to false high or low results. And in a different video, when I'm doing more of the procedure instead of just the facts of blood pressure, I will tell you more about that. Brachial pulse is used to take the blood pressure. Guidelines for one-step and two-step method are on the textbook. Starting on page 236, you need to learn both methods. Do not use the arm. Use arm to take blood pressure if there's an IV in that arm, if there's been an amputation, if there's a cast, if there's burns or injuries. With dialysis, sometimes they'll have a shunt in one of their arms, and you wouldn't take a blood pressure on that side. If they have a weak side from a stroke, you would use their good side. Or if they've had a mastectomy, a breast removal on the right side or left, you would not use the side that the removal was on. Pain management, although pain is not a vital sign, seriously affects a person's well-being. Pain is subjective, something reported to the patient, by the patient, and vital signs are objective, information collected. So pain is a personal experience, therefore different for each person. Pain management, the nurse aide plays a significant role in monitoring pain management and prevention. Care plans are developed using nurses' aides' observations and reports. Questions to ask when you're use residents' own words when you're reporting. Where is the pain? Where did it start? How long did it last? Is it minutes, seconds? How often? How severe is it? You ask them the pain scale. Is there anything that makes it better? Anything that makes it worse? Do you remember what you were doing when the pain started? So a lot of times your nurse will appreciate it if you tell them that they're having pain, if you have more information than just she says her arm hurts kind of thing. This is a picture of this pain scale on a scale from 1 to 10. You ask them, with 0 being no pain at all and 10 being the worst pain possible, how bad is your pain? And then you can also report that to the nurse. And that